My question is specifically about the Forest of Dean. How do we ensure full, free hospital health services for the forest in West Gloucestershire, actually in West Gloucestershire?
Thank you very much. Mark, would you like to take that one?
Great. Yes, thank you for that question. Well, I think the first thing, I mentioned it in my opening remarks. I mean, I think the first thing is the community working together won the battle 4 years ago to keep the Dilk and Lydney open. And I want to see a situation where we have as much as possible done as locally as possible. So I'm very keen on GPs doing as much local health treatment as they can. I want our community hospitals to have more services passed down to them. And I'm very pleased the new Primary Care Trust is actually trying to move in that direction. For example, they want to move some of the chemotherapy services that currently take place in Cheltenham for less complex cancer treatments to actually take place locally. There's been a move to that with the mobile service, and they want to move some of those services into our local community hospitals. I very much support that. The last place you want to go if you're ill, if you can avoid it, is a district general hospital, actually. You want to be in as local a community as possible. It's better for the patient, it has better outcomes, and it's also much less costly. The district general hospital should be reserved for those kinds of services where you need that specialist acute service and you need the sophisticated equipment. The more that can be done locally, the better. And I think particularly because of the geography of Gloucestershire, the more we can have in our own community hospitals and GP practices, the better. And I've demonstrated I've worked for that in the past, and that's what I'll continue to work for in the future.
Thank you, Mark. James.
I got a call from a friend, and he said, James, I'm in real trouble. I have had the most terrible day. And he said, I got up this morning, I got the bus down to Lydney Station, I got on the train, I went up to Gloucester, I went to the hospital, I had to wait for ages, and I came back on the train. I got off the train, and there was no bus, no public transport to take him back into the forest. Can you come and help me? Can you come and pick me up? And I said, yeah, of course I come and pick you up. Where are you? He said, I'm outside Lydney Hospital. This is a problem. The amount of time that people have to go up to Gloucester is a shame. And I agree with Mark. We need to fight, really fight hard for good local facilities here. And I believe that if we really put our mind to it and really fought for it, we could get expansion of services here, and major expansion of services here. And we would suggest that the Dilk is the perfect place to see a new green field. I'm a green, but I'm saying let's build in the forest, let's expand the Dilk. What a beautiful place to not only find health, but also investigate and study. Thank you.
Thank you, James. Chris?
Thank you. So, of course, it was thanks to the community campaign that the hospital was saved. That it was ever at risk in the first place is an absolute disgrace. So congratulations to all of you that took part in that campaign. It was a multi-party, multi-community member campaign. Well done. But you must keep your eyes on what will happen, because there are every sign from the present government and perhaps previous parties who've had the reins of the National Health Service that cut it, that centralise it. We don't believe in that. We want to see the local hospitals maintained and enhanced. The services must be protected, but also improved. Alongside that, of course, we need to give support to general practitioners, to pharmacists for the important work they do at the moment and could do in the future. Additional services, for example, mental health services. Mental health conditions affect 1 in 4 people during the course of their lifetime. Why do people have to travel to Stroud or Gloucester or Cheltenham to meet those services? With that sort of complaint or condition, those services should be local, and we must, as a community, fight for them to be local.
Thank you very much, Chris. Tim, would you like to take that question?
Well, this is a difficult question because I can't claim to be an expert in the administration of medical services. Apparently, nationally, in the last 10 years, there's been a large reduction in hospital beds. And this is something which was planned and is part of the increase in spending on the NHS, and it has been associated with improved outcomes. This is just a difficult subject. Can I just pay tribute to particularly to Mark, in terms of saving the local hospitals, but it's a great achievement. I think, frankly, we want to, trying to understand exactly why these decisions were taken is very difficult. The truth is that nationally, as I said, hospital beds have fallen dramatically in a period when spending on the NHS has increased, and this was deliberate. It was actually to save resources and move resources into better places. It may surprise you, that's actually been planned from the centre, maybe a mistake, but actually outcomes have improved.
Thank you very much, Tim. Bruce, can you round off our debate? Answering that?
I'm rounded up by agreeing with just about everything that Mark had to say about services in the Forest of Dean. It's about the services that we get in the Forest of Dean. It's not about any particular buildings. And you want the best quality services provided as close as you can. So first port of call, you want your general practitioner to be able to provide the services. If they're slightly more complex and they can't be provided on a practice-by-practice basis, you want your local community hospital to be able to provide them. I don't think realistically we will ever get the services of a district general hospital in the Forest of Dean, not the full range, which gives us a particular problem because geographically we've got one way to the rest of Gloucestershire. That's along the A40, and you know the chaos that was caused when the resurfacing from Hynham to Over. That was a nightmare. I would like to see an expansion of services, and I think that Jan Stubbings, the chief executive of the new Gloucestershire Primary Care Trust, has done a brilliant job in bringing together the three previous primary care trusts that existed in Gloucestershire and bringing them back to a firm footing. As somebody who had a dear relative dependent on dialysis, I would love to see dialysis available in the Forest of Dean, along with a range of other services. And if we keep supporting our local community hospitals, that's something that we might be able to achieve. So I think that we're rounding off largely in agreement across the panel.